Good morning, ladies and gentlemen, and welcome to Prostate Cancer Conference Discover the Future. It's our pleasure to welcome you to Ottawa, for those of you who are from out of town, and the guests from Ottawa, and of course our Prostate Cancer Network Ottawa members who are with us this morning. And it is indeed a pleasure for me as Chair of Prostate Cancer Network Ottawa to welcome you in this rather ambitious effort of ours for our first ever Prostate Cancer Conference. We had a reception last evening that many of you attended, and we had a grand time. I think you would agree. And for those of you who missed it, we missed you, but we had a good evening, and thank you for those who were able to make it, and Rocco Rossi, who had a bit of a keynote for us in the evening. Prostate Cancer Network Ottawa has been around for about 25 years. Some of the original members and pioneers of the organization are with us today, and over the years we've picked up many new members, and right now we're 350 strong active members of Prostate Cancer Network Ottawa. We have membership meetings monthly, and some of the folks that are here today and will be speaking to you, some of them we've seen before, and they're great supporters of ours, and we're forever grateful to them for their support. I would draw your attention to the Prostate Cancer Conference agenda, which you all had in your handouts. Of course, any program, any conference of this kind is not possible without partners and sponsors, financially and otherwise. So I would draw your attention to the conference sponsor is Janssen, and we're delighted that Janssen saw fit to provide financial support to us, and we were happy to be able to identify them as our conference sponsor. This morning, of course, the breakfast was supported and sponsored by Sanofi, and a representative of Sanofi, I don't know if she's here, but if not, we're delighted with their support. The others, we will acknowledge the others as we go through the morning when their sponsorship is noted as we proceed through the program. But if you turn the page and look at the bottom, the full range of sponsors are there. Alternative Savings, and some of these are financial sponsors and some are partners, what we refer to as partners. So it would be the Canadian Cancer Survivor Network, Janssen, of course, I mentioned, Innovative Medicines Canada, Ottawa Integrated Cancer Centre, the Ottawa Hospital, of course, major partner, the Ottawa Regional Cancer Foundation, major partner, Prostate Cancer Canada, certainly a major partner, Sanofi, as I mentioned, and Terracera, who came on board and are sponsoring part of our program later on this afternoon. So thank you to them. We couldn't do it without you, and we appreciate your support. Yes, please. This conference would not have happened if it were not for the vision, inspiration, and tenacity of a former member of our Prostate Cancer Network group, who I'm sad to say we lost, and forgive me, we lost him in May. His name is Dan Faber, and Dan's wife, Michelle, is here, and we lost Dan in May. Dan struck out on this conference pretty powerfully, and persuaded our group to take it on, and we did. And I'm happy to say that before we lost Dan, he knew this thing was rolling, and we were going to be fine. Dan and his wife Michelle were great supporters of the Prostate Cancer Network and the Warriors One group by taking participants on interesting adventures and introduce them to new and innovative alternative and complementary cancer treatments. I remember Dan taking the group down to Tweed to the marijuana facility. There was no barrier that Dan wouldn't break. There was nothing that would get in his way because he'd just bowl you over along the way, even with his walker and not always feeling 100%. So we know his spirit is here today, and we have a book at the corner that would, if you would care to sign it in memoriam of Dan, that would be great. I'm going to ask our man in the projection booth to take that picture of Dan, would you kindly, and flip it up on the screen for us, please. I'm pleased to say that in our relationship with the Ottawa Hospital, which has been stellar, we've discovered, I didn't know about it, many probably did, that there's a Guardian Angel program. And this is a program that the Ottawa Hospital Foundation has in order to recognize a staff member of the hospital, doctor, nurse, volunteer, who makes a difference in the care of a loved one at the hospital. And what happens is that the organization or the individual, as the case may be, makes a donation to the hospital in memory of that individual. Well, it's our pleasure, as the Prostate Cancer Network Ottawa, to have made a donation in recognition and in memoriam of Dan's life and work in our midst. And at the same time, we want to recognize that special person who we feel deserves the Guardian Angel pin or award. And that person is Dr. Chris Morash. Come up, please. Now, I'll be right with you. Now, it's only fitting that in light of what I've just spoken about, that Michelle Faber, Dan's wife, read a small testimonial or a small description of why she feels and why we feel that Dr. Morash is a worthy recipient of this Guardian Angel Pin Award. And I'll ask Michelle to do that now.
Good morning. Hello, Dr. Morash. The award, or this medal, is a gesture of gratitude. Sorry. By Prostate Cancer Canada Network Ottawa for your constant devotion to the cause of treating with prostate cancer. Treating patients, I mean. Your knowledge and experience saves many lives by being able to diagnose the disease and to take quick actions in a fast and reliable manner. Your analytical thinking and observation skills allow you to gather and evaluate all pertinent information regarding a patient's health status. Your compassion and active listening skills allow you to give an accurate picture of the situation to all family members about the diagnosis. You can look at the problem through patient's point of view, and you take the time to answer all patients' questions, concerns with respect, knowledge, and competence. And you go out of your way to call anxious patients concerned about their test results. You did that with them. You are an excellent surgeon with an outstanding bedside manner. You never rush in appointments, always display a caring approach, and take the time to explain symptoms, surgery, side effects of surgery, and medication. You provide support in helping to try to resolve whatever health challenges are before the patient. You make patients feel confident and treat them like a human being. Prostate Canada Cancer Network Ottawa is making a donation to the Ottawa Hospital Foundation's Guardian Angel program in recognition of Dr. Morash's exceptional work and service to prostate cancer patients. You has certainly been my family's guardian angel. Thank you, Dr. Morash.
You're welcome. So I'm going to be up speaking in a few minutes, but I just want to say a very heartfelt thank you. That was touching. I knew Dan for many, many years, I think almost 17, 18 years, and always enjoyed seeing him, a great enthusiasm. And when he first came to me with this idea about the conference, you could just see the light in his eyes. He was really, the wheels were really turning, and I think it's, this was really near and dear to his heart, and I'm glad that he knew before he passed that the conference was going to happen. So I just want to say thank you, and I'm very appreciative of the words and the donation. It's, thank you very much.
Great, thanks, Michelle. You did fine. Thank you very much, and thank you, Dr. Morris. Again, I'll just give you a quick rundown. We're doing fine for time. We'll have our first session when we get the folks organized up here and seated and everything is in order. So the first session goes from 9 to 10. It may run a tad long, but I never apologize for an agenda item that goes a little long, given the quality of speakers we have. So bear with us on that. We've got lots of time built into the nutrition breaks and afterwards. So the doctors from Ottawa Hospital will present from 9 to 10. Then we have a nutrition break, coffee break, and then the same panelists will reassemble, and then they will take questions. Now, in order to facilitate and make that questioning efficient, so we all get the benefit of their expertise, there are question papers at your table, and as you're going through, if there's a question pops to your head that you think is really relevant to the topic and you'd like to have it answered, write it out. David Cook, David, where are you? David Cook is our canvasser. So David's in the back, looking all officious there with his shirt and tie and looking great. And David will be around to collect those. Jennifer Van Noort will be assisting David when the doctors are finished their presentations. They'll review the questions, and we'll try to pick out the ones that represent as many areas of the subject matter as we can, and then we'll present them to the doctors, and we'll proceed from there. We think that's the most efficient way to have this Q&A work, and we appreciate your cooperation for that, and we'll do our very best to get as much in terms of content and variety in the Q&A in the second part after the coffee and nutrition break. Good, understood? Good to go? Okay, good stuff.